Marshall Bloom, Associate Director for Scientific and Management of Rocky Mountain Laboratories, National Institute of Allergy and Infectious Diseases.
Wonderful. All right, Marshall, everybody's talking about Ebola right now, and of course Ebola is nothing new to you folks at your facility. I understand you've actually been working on this particular virus for a long time, is that right?
That's correct, Peter, and I want to say that the current situation in West Africa is a humanitarian crisis of unprecedented and unimaginable proportions, and I think our Western Montana should take pride in the fact that members of our community are able to go over to help in these humanitarian missions. But you're absolutely correct. Our laboratory has been working on Ebola virus and similar biosafety level 4 viruses since about 2009.
All right, and tell me the kind of work you've been doing, if you can.
Well, the number of the studies that are going on are really turning out to have some amazing practical implications in the current situation. We have had investigators here working on potential vaccines for Ebola virus since the time they got here, and in addition, they are also involved in doing some of the testing for some of the other therapies which people have read about in the popular media. So, our investigators are highly trained, highly skilled, and highly educated. They take their work very, very seriously. The amount of the training and background that they get is absolutely almost unbelievable, the amount. But they are all extremely careful. They recognize that these are serious infectious diseases, and we work very, very hard to try to prevent any kind of a mishap.
Now, can you explain the relationship that you have with your facility and, of course, the overall aspect of your facility with St. Patrick Hospital? I know that there is a relationship that began about 10 years ago.
That's correct. When we began planning for the construction of our building, which we call the Integrated Research Facility, there was a lawsuit that was filed, and as part of the settlement agreement, the National Institutes of Health agreed to oversee construction of a facility to take care of patients with serious infectious diseases at a hospital within 75 miles of Hamilton, Montana. The St. Patrick Hospital was awarded that contract, and that led to the construction at St. Patrick Hospital of what they refer to as the Care and Isolation Unit. So we have been involved. We've been involved with that for that's almost a decade now. We have worked with the staff at St. Patrick Hospital and the infectious disease physicians up there and our infectious disease advisor to develop training protocols. We do drills and simulations. But I have to tell you, in my wildest dreams, never would I have imagined that facility might be called into play to play a role in a humanitarian crisis such as the one we're seeing in West Africa.
Now, Marshall, anything can happen with a virus or a disease of this sort. I'm sure that you're probably much more aware of that than anybody else, probably here in Western Montana. But is there a risk that it could eventually get to Montana, or would people who are infected in some other states be transported to this area because of the facility that we have here?
Well, I think it's important to recognize, as our director, Dr. Anthony Fauci, and Dr. Tom Frieden, the director of the Centers for Disease Control, have stressed on many occasions that really any hospital in the United States would be capable of taking care of a patient with Ebola virus. And I would hasten to add that there have been people treated for these infectious diseases in community hospitals in the United States, one in Colorado Colorado as recently as 2008, and there were no problems associated with that, no secondary cases at all. So the answer is any hospital, if a patient showed up with one of these infectious diseases, and now, of course, the focus is on Ebola virus, any hospital with the proper precautions and following the extensive and excellent guidance that the Centers for Disease Control has put out would be able to safely care for one of these patients.
Well, it's amazing you would say that, because I just left 15 minutes ago Pamela Whitney over at Community Medical Center, and she was kind enough to give me a video tour of their zero pressure rooms or negative pressure rooms, and they were actually having drills to show their staff the proper way to handle these communicable diseases.
I think that's very, very commendable, and I'm sure that there are a lot of hospitals in the United States that are doing exactly that. I mean, our medical system is extremely good. Our public health system is extremely good, and here in western Montana, and where our listeners are, I mean, they're very good. I mean, we have experience with a number of them, and the Ebola virus is certainly a very, very scary infectious disease. But as Dr. Reese pointed out in the media the other day, these things are to be respected just like any of the other infectious diseases we deal with. And although it's hard not to be anxious, I mean, we certainly know how to deal with them. There are a lot of other very, very serious infectious diseases which are way more communicable than Ebola virus is. Tuberculosis is an excellent example. And these rooms with the negative pressure, which you described at community hospital, those are also very, very good for taking care of patients with diseases like tuberculosis.
All right. Anything else you'd like our listeners to know to perhaps calm some fear?
Well, I think that the United States, first of all, let me say this: let me reiterate that what's going on in West Africa is a humanitarian disaster of unprecedented proportions. I think, as others have pointed out, it is conceivable that additional cases of Ebola virus could pop up in the United States, but our public health system and our medical care system is totally prepared to deal with these.